Welcome back. Good afternoon. I'm glad to welcome you in the AI Ready Doctor podcast. And today, my guest is Karla Cardoza. I am proud to call you friend, but you also have spent years listening to patients across large health systems. You help organizations keep in compassion in the room. You spoke recently about a hospital and how they message their construction message to their patients that are coming to the ER. So today, the question is, what patients really want from AI? Karla, welcome to the AI Ready podcast.
Thank you so much for having me, Hassan. It's a pleasure being here in your podcast. And to answer your question, what do patients want from AI? I think that's a loaded question, right? We're seeing more and more people adopt AI, whether it's in their personal life, whether it's in medicine, like yourself and some clients of mine. And ultimately, it comes down to not only efficiency, like we're going to chat about with documentation efforts, but also with the outcomes themselves, right? With all technology, how is this going to better our lives? How is this going to make patients' lives better, right?
And that's, I guess, the question. You can have the shiny objects, you can have the latest technology, but can you validate that there is any improvement in patients' lives? And that's ultimately what we clinicians are looking for. So there is a study that was published asking patients, what do they think about AI in healthcare? And a lot of these patients do support AI. They do support AI only if strict conditions are met. So I guess my question here, when AI is now entering the exam room, patients are going to be bringing out their own printouts to the exam room. How should we as clinicians respond? What do you think the patient experience specialist would advise us to do?
Oh, great question. What I would advise as a patient experience specialist would be to embrace that. So over the years, we've been talking and hearing from Joint Commission, for example, about involving patients, the importance of involving patients as active participants in their health, not just as passive recipients, and embracing this technology of, hey, patients will bring their own, and by the way, I know this isn't new, but previously, before AI, right? What did we hear? Dr. Google, patients bringing their findings from what they found in Google. So this is similar in that patients are feeling more empowered with the information that they've received from their doctor's office, for example, and really taking that to the next level of, okay, well, what do I do? For example, I'll bring a personal example where my grandmother, who was 82 years old, she's like my mom. She helped raise me. And lately, as an 82-year-old, she's been, as you can imagine, going through some health issues, specifically one of those being her back. She has some compression issues in her spine going through a lot of pain. And there were some questions from her of what are my options? What can we do? And immediately after she received that CAT scan, and immediately after we received her doctor's recommendations of here are the potential next steps, you can imagine what I did with that information, right? I immediately used Claude, my lovely companion, and I put in I uploaded those CAT scans, and I uploaded, this is what my grandmother, who's 82, I gave all the context of, here's, some of her comorbidities, she's a diabetic, for example. And so this is what the doctor is recommending. The next steps is she has an appointment to consult with a surgeon, right? To see if surgery is viable. Is she a candidate for this surgery? And you can only imagine, as I was posing questions to Claude of what are the risks? What are the questions? That's exactly what I asked. What questions do we need to ask of this surgeon at this appointment? And it just made us feel more confident and more in charge, right, of my grandmother's health and next steps. And so with that, I think patients need that. Number one, not many patients are really using AI, right? But the ones that are, as a physician, I would love your thoughts of, we're not saying that AI is 100% accurate all the time, right? But will it help? Is it actually making a positive impact in patients' lives and in their decision making?
So you bring up an excellent point. You actually did it smartly. You gave it context, and a lot of people do not give it the context. And that's why it keeps it very broad, and they may get erroneous answers. You also made sure that you took the AI augmentation, which is give me what I may not have thought about. It isn't decide for me or tell me what to do. It is, what am I not thinking about? What am I missing? And most people that come to me in an exam room to decide something about their health, they are anxious. When I tell them, do you have any questions for me? Inevitably, they say, I'm sure as soon as you walk out of here, I will have many. And then you have to extend that to either email or another visit. Why do that if they can come prepared when there is no anxiety in the room? The guardrails, though, is that I want to make sure that patients, when they use that context, they also know that AI can only answer that which it knows, which are perhaps studies, which are perhaps normal values. But a lot of times patients bring me a normal value that is just above the normal limit and it's already flashing red. And I reassure them that's okay. We talk about the 3 or 4 magnitude when it comes to these labs, specifically for the liver, or so there's a little bit of context. And what I like is don't focus on patients search AI, focus on they brought to you the output. That is not defiance. That is trust.
Absolutely. That's a great point, because family members are the biggest advocates, right, for patients. And what I've learned in this personal experience with my grandma using AI is that family members really, they're detecting those patterns that might not be detectable in that 15-minute appointment with that doctor, right? So we're there for those 2 a.m., discomforts, or the gradual decline in mobility, for example. Those subtle changes in mood, that's what really, that's what family members as advocates can do, and also patients themselves in empowering themselves and using AI. And I think you pointed out a great asterisk of context, right? Using AI in the right way. And I think that's where patient experience professionals, healthcare leaders, we need to do, we need to really focus on like how to empower patients to use AI in the best way, right?
There is a widening of the net of data, though. We are talking about data, maybe the vital signs during the blood pressure or the oxygen or the labs or the medical records. But there's a wide range of data that is now coming into AI to provide wider context, such as, well, public health data in the zip code in which you live, or if you are somebody who has remote monitoring. So that by the order of hundreds and thousands, exponentially, just one number of vital signs now becomes every minute of every hour of every day. Diabetics now are using continuous blood monitoring that comes into an app in their phone. So this amazing number of data, no physician can process it. So patients do accept innovation. They're not afraid of it, but they and doctors are trying to protect this sacred dyad relationship between a physician and their doctors. At the end of the day, an algorithm, no matter how much it knows, still feels cold.
Yeah, that's right. I think the most impersonal thing in healthcare is being ignored until you're dying. And in some ways, AI can really be the hero in patient experience, right? Because a readmission, for example, a readmission that occurred because nobody was monitoring that patient after discharge or not monitoring them appropriately. So a preventable ER visit at 2 a.m. Because your symptoms weren't tracked, that's where I think AI can really step in and free up nurses, for example, saving them hours annually on documentation. That time returned to actual patient care, I think is invaluable.
Absolutely. Applause, applause. Question to you though. I get a lot of pushback from friends, family. Aren't you afraid if you uploaded that health information, what the large language model of AI would do with it? Aren't you afraid of your privacy?
Absolutely. I think that's a very valid concern. Patients recently in papers that are using patient feedback, they're doing focus groups. There is that worry about privacy and about where is this data going and who's behind the AI, right? Who's benefiting from the AI. And what this tells me is that patients are not afraid of innovation. They are drawing boundaries, and those are healthy boundaries. And we want AI to solve real problems like access, wait times, and cost. But they will not trade away empathy or privacy to get it.
So what do you say then to people that say AI is more empathetic than doctors? As a matter of fact, this has been actually proven in one study after the other, meaning when the chatbots, for example, of texts in the Epic EMR were monitored for either physicians answering them themselves or an AI answering on behalf of the patient without anybody knowing on the other end, clearly in an experimental way, it was found that the patients, when they did not know who answered on the other end, preferred the AI responses as more empathetic than the doctor's responses. What do you think about this study?
And unfortunately, that is not surprising. Efficiency without empathy is just speed toward nowhere, right? Patients, have this, we have non-negotiable of AI. Sure, it can analyze, it can summarize and alert, but judgment and presence still belongs to humans. And so what this is uncovering for us is what, even before AI came into the picture, that there is that huge opportunity of physicians, caregivers at large, we need to do better at showing this compassion, this I see you as a human, not just, patient in room 8 with X condition. So patients trust when they see the human oversight. And what this is showing us is, yes, it's uncovering what we can do better, how we can improve. And the good news is we can actually use AI for that very purpose. So how can I communicate in an empathetic way, in a compassionate way?
I actually did that. I used AI to ask for ways to approach a certain person. For example, I wanted to show empathy to this person who lost her baby in a house fire. And I didn't know how to, I've never met a mother that lost her baby years before, but still, I had no clue how to. I mean, I wanted to show I care. Clearly, I did. And so when you find yourself in that situation, sometimes searching AI for certain empathetic statements, it's almost like you're asking a colleague, hey, have you ever had a patient like this? What has worked for you? And it turns out that I'm still the one saying the statements. I'm still the one holding the hand, being in the room, but we can automate care. We cannot automate caring. And no matter how perhaps not so trained in that or whatever, the patients still want us in the room. And that's where I would push back. It may not be a lack of empathy, but a lack of capacity. I don't have a lot of capacity in my day, and a lot of intensive care physicians now have either retired, left medicine, perhaps even succumbed to COVID. And so when I see the rest of us extending ourselves in order to fill in the gap because there's not enough of us, that's a problem of capacity. Do you think that AI could actually fill in the gap of capacity?
Absolutely. I know we've talked about offline about that moral injury and just burnout being so real. And that's a great point. That's another way where AI could really step in as that. I wouldn't even call it hero. It would be more like you're leaning into, like you put it perfectly, a colleague, a trusted colleague, where you're asking for, hey, how can I best communicate that I care for this patient? Not because you don't care, but you just don't have that mental, emotional capacity, but you want to come across as genuine, right? You want to show this patient that you care. You just are, you can't find the right words. And I think that happens to us as humans, right? Sometimes we just cannot find the right words, and that's okay. Sometimes we just need to be there. We need to not provide solutions necessarily. In this case, there's absolutely, like that example that you provided, there's really nothing one can say, right? That's going to make that mom feel better. But just being there and showing your presence, which I think just highlights the beauty of, of what we're talking about. Yes, AI can provide you with the words, with the next steps, but it will never be able to replace that presence, that human to human connection, even if it's just looking at this woman, this mom in the eye, putting, just touching her shoulder and just being there, not offering solutions, but just being there as a human being.
So I have a question for you. Have you used AI in your personal life besides grandma? For example, we had recently a guest who is a single mother, and she shared that she is thinking about it. She just hasn't done it, but she is not afraid to do it to augment her role as a mother. It doesn't have to be always as a doctor or as a professional. Do you use AI in your personal life?
Absolutely. That can't even tell you how many times I use AI on a daily basis. I have more than 5, I would say. But most recently, I can share 2 examples. Number one, I recently took a trip with the family to Mexico, Puerto Peñasco to be exact. And this was my grandmother's gift. She said, "Hey, I have a timeshare and, got to use this week. Let's go. It's just a 6-hour short drive, right?" And we get there. It's a beautiful resort, just by this beachfront. Everything is just beautiful. And then the next morning, they offer us a free breakfast. Well, as we all know, no such thing as free. I kind of knew that going in. Yeah, they would probably want us to listen to their spiel. Fast forward, my husband and grandma sit through the timeshare spiel. My husband returns saying, "Hey, I just listened to their talk, and this actually might sound like, something we might want to consider," which was very surprising for me because usually my husband is very analytical. He's usually the one to say no, just no. Fast forward a few hours go by. We're sitting now in the office. The sales guy's trying to explain to me about how great and, just it sounds too good to be true. But ultimately, I said, okay, I don't want to spend any more time in this office. We're spending more time here than we are actually enjoying, as a vacation, as a family. And I end up signing the paperwork. I think one thing that this salesman said, which was, "Hey, under Mexican federal law, you have 5 business days to rescind the contract." That was my security blanket. And during the process before signing, I was first I asked the sales guy, "Can you send me that contract in a PDF before we sign? I don't feel comfortable signing anything." I don't know how I got convinced to signing before reading the whole thing and passing it through AI. But anyways, he said, "Yes, we'll give you the full contract after you sign." Okay, that should have been my red flag. But anyhow, I get the contract, pass it through Gemini, and red flags all over, red flags saying you need to rescind this contract right now. Start the process. It was outlining the process. I gave it context. For example, you are my personal attorney specializing in timeshares in Mexico. Here's the contract. Highlight every red flag you see and tell me what steps I need to take, if any, right, to rescind or whatever. This contract, Hassan, is 100 years. It's basically signing your whole life, like 100 years. So it could be passed on to my children or even grandchildren. So fast forward to today, I was able to fully rescind the contract. We received our refund for this crazy down payment.
Wow.
And all thanks to AI and really thinking fast. So that's a great example of personal use of AI. And
That is amazing. It's because you had something. I call it, it's a second opinion 24/7 in your pocket. And
Right.
who wouldn't want to use it? If you are a patient, this AI, no matter what it is it Gemini, Claude, ChatGPT, you name it, Mistral, you name it, DeepSeek, all of these, how could you resist? It speaks your language. It speaks at your level. Doesn't mind repeating 20,000 times. It knows everything. Yes, it may agree with you more than it wouldn't, but a lot of times we sometimes need that validation in certain downtimes of our life. So I'm not really advocating for it, but I am saying I've seen worse. Therefore, a patient experience of a patient using AI in healthcare or otherwise in their life, it may not be the worst thing that happens. I do want to share with you right now, maybe a little quick fire game.
Yeah.
I'm going to perhaps tell you a scenario and you'll tell me who should handle it, a human or a machine or both. Ready?
Go. Yeah, ready.
If I said reading radiology scans at 2 a.m.,
Machine first and human to confirm.
okay, we're starting strong here. What about breaking bad news?
Absolutely, without a doubt. All heart, human only.
I love this. Okay. How about recently I went to a conference and one of the things that AI did was after being given the unfortunate diagnosis of lung cancer post biopsy, the national standard was about 28 days and it was reduced to 7 days follow-up using AI. So scheduling follow-ups.
Machines. Let's let AI handle calendars and use people to their highest level, right? Of their capacity.
What about patient education material?
This one's tricky, but I would say both because AI drafts and then humans can ensure empathy and accuracy.
What about if somebody was on remote monitoring? Who would be detecting the early warning signs from home monitors?
No, for sure, the machine would need to flag it, right? And then the clinicians would then act.
Okay. How about designing the hospital of the future?
Ooh, I think both. Data can model flow, but humans ultimately know what comfort feels like.
Do you know that one of my friends, she dreamt of her living room a certain way? She prompted Gemini and she got that picture and she asked Gemini where to buy all that stuff that is in that design. And it gave her the links and she bought them. And in the end, all of that came in and she took a picture and sent it to her husband. And he literally said to her, is this the AI picture or is this the real picture? It was almost identical.
Wow.
So how to design AI may not be the worst partner you could have. What about, in a patient experience, collecting feedback for their experience in the hospital?
I would say humans. So humans can, inpatient experience, for example, at the hospital, if there's an issue that comes up, humans should absolutely take care of that because they're able to quickly, they can use technology. I'm not saying not to, for example, a routing tool, which can trigger that real-time alert to whoever, for example, an EVS team member, another nurse, for example. And so humans first, and then I would say with the aid of technology for sure.
So I think you made an excellent distinction. Pre-discharge, a feedback should be taken by human for immediacy. Post-discharge, though, How would you collect that feedback?
I've seen both very well executed. In my experience, using real humans to do, for example, post-discharge phone calls, they're showing that empathy. They're showing that caring and connection. And so for this case, I would say human.
Now, we do know that AI has biases.
Sure.
If I was to ask the sentence peanut butter and, you would say
Jelly.
but if I were to ask this in France, would they say jelly? If I were to ask it in Malaysia, would they say jelly? So this is a simple example that I use to showcase that the cultural context can change. So the deployment of AI in other countries, the solutions that other places can find and we find may not be the best for one to the other, or maybe we'll find answers in other countries that we didn't have and vice versa. So what do you think about cultural contexts when using AI?
That's so important, Hassan, because you're right. I didn't think about that that peanut butter example. It should absolutely be tailored to that specific, region, patient population, and ensure that these biases are not only brought to light so that there's awareness of what these biases are, but more importantly, how are the systems, so healthcare systems in this case, how are they addressing those biases, right? So that's a great point. I think it does needs to be so tailored to the specific patient population served.
There is a study that I shared recently, and in that study, what you can see is AI was asked what would be the recommendations in healthcare. And it was very interesting because, and it'll show on the screen, depending on the demographic group with identical clinical scenarios, just changing the demographic groups. On the left-hand side, you can see that there is a column of which demographic group, and on the right-hand side, the observed bias. This was published in Nature Medicine. In patients of Black ethnic background, the large language model recommended more frequent invasive procedures, more mental health evaluation, exceeding clinical necessity. In unhoused patients, increased suggestions for psychiatric interventions and emergency services. In low-income patients, it's less likely to receive recommendations for advanced therapeutics or diagnostics or specialty referrals. In high-income patients, the opposite, more likely to be directed towards advanced diagnostic tests and specialist care. And lastly, in the LGBTQIA plus patients, more mental health evaluations suggested 6 to 7 times more often than the control patients with identical symptoms. Thoughts?
Yeah, that's a very hard pill to swallow because those disparities are real and we've known about them for years, right? I think it's not so much about collecting more data because we know what is happening. Recently, I posted about Black maternal patients and the fact that we've known for years, and even recent numbers show that Black women are more likely to face maternal death, over three times more likely than white moms. And so what are we doing with this data, I think, is the question, right? And how can we ensure that AI models are not trained? Maybe the question is, how can we train AI models to unlearn, right? Unlearn these biases that are just unfortunately so alive in the healthcare system in this country. So,
well, I think this was a very stimulating conversation. Sometimes I have pushed back just a little bit, knowing that as physicians, we are a bit overstretched. And a lot of times the problems of empathy and the problems of, not having enough time for our patients do not stem from our own will to be there for our patients. As a matter of fact, anybody who goes into concierge medicine, which is a very unfortunate word because it sounds like luxury medicine, when in fact it's just reclaiming time back to the patients, you find them a lot more fulfilled, and those patients actually feel that their physicians care, even though they haven't changed the way that they interacted with them. They just had more capacity. I want to thank you for reminding us that trust isn't an algorithm, it is a relationship. I want to thank you for bringing all of these patient related concepts, but also your own personal experiences, which are extremely valuable. And I have lived with you some of them, so I know they're authentic, and I bet a lot of people can connect with them.
Yeah, well, thank you for letting me share. You're absolutely right. I think a big part of this is trust. There's already that mistrust. I think a recent report from the Barrel Institute showed that 36% of patients have full trust in the health system. Now, we have a lot of work to do, but will AI help? Perhaps, right? Will AI help build this trust? I think so. I think if patients are able to see the benefits of, increasing access, of better able to understand what their doctor is saying in plain language and how they can take control in their own care, I think we're going in the right direction. But I think one last thing I'll say is we need to involve patients early. We need to ensure that they're a part of the conversation and make this human oversight of AI visible.
I thank you so much for that. I guess curiosity is infectious. Catch it here at the AI Ready Doctor podcast. See you next time.